Hello everyone. In this video we are going to see about axillary artery. Axillary artery is an artery which is an extension of subclavian artery. Axillary artery starts from the lower border of the first strip, extend from the outer border of the first strip. So in this picture, from outer border it is called as axillary, before it is subclavian artery. Then it extends till the lower border of teres major. So here, below the teres major continues as brachial artery. And parts. It is divided into three parts by pectoralis minor muscle. So pectoralis minor muscle divides into the first part, which is above the pectoralis minor muscle, and the second part, which is below the directly under the pectoralis minor muscle, and third part is below the pectoralis minor muscle. So coming to the branches of axillary artery, it gives the first part gives one branch, second part gives two branches, third part gives three branches. And mnemonics to remember this thing: slap the lawyer, save a patient. So writing the first letter down, STL, so superior thoracic artery, thoracoacromial artery, lateral thoracic artery, subscapular artery, anterior circumflex humeral artery, and posterior circumflex humeral artery. So coming to superior thoracic artery, it supplies pectoralis major muscle and minor muscle and also thoracic wall. And second one, thoracoacromial artery. So this thoracoacromial artery gives four branches, namely pectoral branch, clavicular branch, acromial branch, and deltoid branch. We can remember this thing by a simple mnemonic: A, B, C, D. So A is for acromial branch, B is breast or pectoral branch, C is clavicular branch, and D is deltoid branch. And coming to the lateral thoracic artery, it flows along the lower border of pectoralis minor muscle, and in females it forms lateral mammary branches. And subscapular artery, it is along the lower border of scapularis and termed at the inferior angle of scapula, and it supplies latissimus dorsi and serratus anterior muscles. And major branches are circumflex scapular artery. We will see this in anastomosis. So anastomosis around scapula. So around scapula, the thyrocervical trunk and the axillary artery forms anastomosis. The suprascapular artery of the thyrocervical branch forms anastomosis with the acromial branch of thoracoacromial artery and posterior circumflex humeral artery. And the lower border circumflex scapular artery forms anastomosis with the suprascapular artery. So thank you for watching. Goodbye.